1 in 5 young people right now is living with a diagnosable mental health condition. Not feeling a little stressed. Not going through a rough patch. A clinically recognized disorder that is actively disrupting their ability to function, learn, and connect with the world around them. And in the last decade, that number has not stayed flat. It has surged by over 50%. Something is happening to an entire generation, and most of us are only just beginning to understand how serious it really is. In the next 10 minutes, you are going to discover exactly how we got here, what the data is actually telling us, and why the solutions most people talk about are barely scratching the surface. We are going to look at the science behind why young people today are struggling in ways previous generations simply did not, the hidden forces driving the crisis that rarely make headlines, and the one finding from researchers that completely reframes how we should be thinking about all of this. Stay with us, because this story is far more layered than you might expect. To understand where we are today, you have to go back to around 2012. That year marks a critical turning point in youth mental health data across the United States, the United Kingdom, Australia, and much of the developed world. Before 2012, rates of depression and anxiety among teenagers had been relatively stable for decades, with modest fluctuations tied to economic downturns or major world events. Then something shifted. Rates of teen depression began climbing sharply. By 2019, before the pandemic even entered the picture, the share of American high schoolers reporting persistent feelings of sadness or hopelessness had risen from 28% to 37%. Suicide rates among people aged 10 to 24 increased by 57% between 2007 and 2018. These are not small statistical blips. These are generational signals. Researchers began asking the obvious question, what changed in 2012? The answer that kept appearing in study after study was the smartphone and the social media ecosystem built around it. By 2012, smartphone ownership among teenagers crossed the 50% threshold. Social media platforms were no longer just websites you visited occasionally. They became always-on environments that young people carried in their pockets every waking hour. Jonathan Haidt, a social psychologist at New York University, has spent years documenting this connection, arguing that the great rewiring of childhood that happened between 2010 and 2015 fundamentally altered how young people form identity, process social comparison, and experience rejection. His research, along with colleagues like Jean Twenge, shows a remarkably consistent pattern. Teenagers who spend 5 or more hours per day on social media are 66% more likely to have at least one suicide risk factor compared to those who spend 1 hour or less. But here's what nobody talks about. Social media is not the whole story. It is a significant amplifier, but it is amplifying something that was already under strain. The mental health crisis among young people sits at the intersection of at least 5 major forces operating simultaneously, and isolating any single cause leads to incomplete solutions. The second major force is academic and economic pressure. Today's young people have grown up in a world shaped by the 2008 financial collapse, the student debt crisis, and a labor market that increasingly demands elite credentials for middle-class stability. A 2023 survey by the American Psychological Association found that 77% of Gen Z respondents identified work and money as significant sources of stress, higher than any other generation surveyed. The pressure to perform academically begins earlier than ever, with many children experiencing standardized testing anxiety before they reach double digits in age. The third force is the erosion of unstructured time. Developmental psychologists have documented a dramatic decline in free play among children over the past 4 decades. Unstructured play is not just fun. It is the mechanism through which children develop emotional regulation, conflict resolution skills, and resilience. When that time gets replaced with supervised activities, screen consumption, and academic enrichment, children lose critical developmental experiences that once built psychological durability naturally. The fourth force driving this crisis is loneliness. And this one deserves special attention because the numbers are genuinely alarming. A 2023 report from the U.S. Surgeon General declared loneliness a public health epidemic, noting that even before the pandemic, Americans reported having fewer close friends and less frequent meaningful social contact than at any point in recorded survey history. Among young people, this is especially pronounced. Surveys show that Gen Z reports the highest rates of loneliness of any generation, despite being the most connected generation in human history by every technological measure. The paradox is not lost on researchers. Connection has become abundant and cheap. Deep, sustained, face-to-face intimacy has become rare and effortful. The fifth force is systemic underinvestment in mental health infrastructure. The average delay between the onset of a mental health condition and a person receiving treatment is 11 years. 11 years. That is not a system that is struggling. That is a system that has collapsed. In most parts of the United States, a child experiencing their first depressive episode will wait weeks or months for an initial appointment with a therapist, assuming their family can even afford one. School counselors, who are often the first line of support, are overwhelmed, with national ratios averaging one counselor to every 415 students, far above the recommended ratio of 1 to 250. Now here is where the analysis gets genuinely surprising, and this is the finding that researchers say reframes the entire conversation. When scientists study resilience in young people, meaning those who experience significant adversity but maintain psychological stability, the single strongest protective factor is not therapy access, not reduced screen time, not academic success. It is the presence of at least one stable, caring adult relationship. Not many relationships. Just one. A parent, a teacher, a coach, a mentor. One consistent adult who communicates belief in that young person's worth changes the statistical trajectory dramatically. This suggests that while systemic solutions matter enormously, there are things happening at the individual human level that have an outsized impact, and they cost nothing. The pandemic did not create this crisis. It accelerated and exposed it. Between 2020 and 2021, emergency room visits for mental health emergencies among adolescents rose by 31% for girls and 24% for boys compared to the same period in 2019. Children who already had limited access to mental health support lost even the partial scaffolding they had, including school structure, peer contact, and extracurricular connection. The trauma of that period is still working its way through a generation that experienced formative developmental years in isolation. What does meaningful progress look like? Countries that have taken a comprehensive approach offer useful models. Australia launched a national youth mental health initiative called Headspace, creating over 150 community centers specifically designed to be accessible and non-stigmatizing for young people. Early data suggests these centers meaningfully reduce the gap between symptom onset and help seeking. In the United Kingdom, the National Health Service has invested in expanding mental health support directly inside schools, training teachers to recognize early warning signs and create referral pathways before crisis points are reached. These are not perfect systems, but they represent what happens when mental health is treated with the same urgency as physical health. The conversation around social media regulation is also evolving. Several states have now passed legislation requiring age verification for social media platforms, and the U.S. Surgeon General has publicly called for warning labels on social media apps similar to those on tobacco products. Whether these measures prove effective remains to be seen, but the political will to treat digital environments as a public health concern is growing in ways it was not 5 years ago. What this moment demands is an honest acknowledgement that we built systems, economies, and technologies without adequately considering their impact on the developing minds of children and adolescents. The young people experiencing this crisis did not choose it. They inherited it. And the data tells us clearly that waiting for individuals to simply become more resilient without changing the conditions they are navigating is not a strategy. It is an abdication. Before you go, if you learned something valuable today, hit that like button right now. Subscribe to Trend Now Daily for a brand new video every single day. We will see you in the next one.